Hi, my name is Maria Meindl, and I'd like to welcome you to The Work, Straight Talk on Craft and Method, where we talk about the histories of wellness and performance training methods. Today, I'm going to discuss a wonderful book that came out in the last few months, and that is Kate Gies's memoir, It Must Be Beautiful to Be Finished. Gies was born with one ear, and she writes about the agonizing experiences she went through when doctors tried to fix her. This meant making her more symmetrical, more attractive, according to their definitions. A lot of the book is deeply rooted in the child's point of view. Her pain and suffering are front and center. It made me think about just how inhabiting a point of view can be subversive and how triumphant on Gies's part. We see the schism between the inner experience and outer appearances that the doctors are striving for. She gives that inner experience voice, not just in terms of the procedure she's living through, but also in terms of her feelings of self-worth as a human being. There's also a framing story, which shows the impact of all this medical trauma on her life as an adult. We see what she's gone through and continues to go through in order to not feel broken or wrong. It Must Be Beautiful to Be Finished has received tons of well-deserved praise. As far as I'm concerned, it should be required reading for anyone involved with medicine, not just doctors, but also physiotherapists, nurses, especially policymakers and medical educators. But I'm here to talk about another element of the book. Gies was at the mercy of the mainstream medical establishment for many years, but she also mentions her brushes with what we might call alternative healthcare. And these incidents are no less powerful for taking up a smaller portion of the story. At one point, as an adult, she gets an ear infection and asks Dr. Google for advice. It's here she reads about inflammation. Quote, "The internet leads me to site after site about how to diminish inflammation. No gluten, no sugar, no caffeine, no soy, no dairy, no tomatoes, no fried food, no starch, no eggs, no beef, no pork, no processed food. A surge of optimism rushes through me. I can control this. I can purify my body. In a matter of days, food becomes an obsession, a new way to exert control over my unpredictable body. It will be weeks, months, years of this, and my body will shrink closer and closer to its bones." End of quote. Later, she describes this mindset as trying to, quote, "make up for my damaged body through diligence and willpower," end of quote. Even though mainstream medicine can be slow to change and reluctant to see its faults, over time, change happens. Books like this can and will make a difference. But the world of wellness or alternative healthcare also has a lot to answer for. As a Feldenkrais practitioner, I'm part of that world. And as far as I'm concerned, we all need to take a good, hard look at our own past in order to progress. So today, I'd like to introduce you to Louis Kuhne and his science of facial expression. His dates are 1835 to 1901. He was German. He is considered still a pioneer of naturopathy. Before I say anything more about him, I'll note that he wasn't alone. He was part of the Lebensreform movement in Germany. That's a predecessor to what a few years ago we might have called New Age. We might now call it wellness. It incorporated physical movement, diet, supplements, time spent outdoors, all as part of a program to take control of one's life through the body. Lots to say on that. Stay tuned. But back to Kuhne. Here's a present-day description of his contributions by naturopath Susanna Chiranko. Quote, "Louis Kuhne stands rightfully tall in the naturopathic landscape because he indeed contributed hugely to its philosophical and knowledge base. Kuhne's understanding of healing came firsthand from his personal suffering with stomach cancer and lung complaints. End of quote. Please note, Kuhne's ideas are built on self-observation. Later, he may use anecdotal evidence to prove his point, but it's a very interesting pattern to watch when it comes to wellness practices. A lot of the time, their origin stories include some kind of self-healing. Number one question then, do these ideas spring from observing a lot of bodies, a wide range of bodies, a small number of bodies, or just the author? In this case, a white male. Kuhne had no formal training. He started as a carpenter's journeyman, but he'd suffered from poor health all his life. Orthodox medicine didn't help him, so he became an entrepreneur. He manufactured sitz baths, or what we might call hip baths. His patients would place their hips in a cold water bath and be rubbed or rub themselves with rough linen cloths. He also manufactured steam baths. He wrote and sold books about improving one's health. He advocated a vegetarian diet and eventually transformed his factory into a clinic. Here's his philosophy as outlined in his book, The New Science of Healing, 1894. Quote, disease is the presence of foreign matter in the system. There is only one disease. There is only one cure. End of quote. And that is to purge the foreign matter through steaming, baths, or diet, which included eating sand. So I'll give you an example of a day's meals. Breakfast: wholemeal bread and fruit, or wholemeal gruel with bread, or oatmeal porridge with fruit and bread, milk only unboiled. Dinner: if soup, it should be thick, or cereals served as thick porridges, such as rice, barley, groats, oatmeal, made only with water and a little butter, or perhaps the addition of a little fruit or pulse, such as peas, beans, lentils, boiled thick with water only and not mashed, seasoned with marjoram or pepperwort if liked, or any vegetable that the region affords and that is in season, or stewed, or fresh fruit with wholemeal bread. Supper: wholemeal bread and fruit, fresh or stewed, or a gruel of flour or wholemeal, boiled thick with bread or fruit. Please, sir, I want some more. To give you a sense of the man's logic, let's look at a section of the book called The Science of Facial Expression. And this is an English translation from 1917, more than 15 years after he died, which tells you something about his enduring popularity. Quote, disease arises through the presence of foreign matter in the body. Such matter is first deposited in the neighborhood of the orifices of the abdomen, whence it is distributed to the various parts of the body, especially to the neck and head. This morbid matter changes the shape of the body, and from this change, the severity of the disease can be observed. Upon this fact, the science of facial expression is based. To deny that foreign matter accumulates in this manner is to dispute the truth of the science of facial expression. But the fact that the state of the body can really be ascertained from changes in the form is scarcely to be seriously contested, and this, indeed, is the soundest proof of the connectedness of my whole, of the correctness of my whole theory of disease. End of quote. Okay, he describes what he calls normal faces, which he admits hardly exist anywhere. But with toxins, the body develops these encumbrances. There are front, side, and back encumbrances, and these encumbrances can predict serious illness. And getting rid of them can cure illnesses, including TB and cancer. In the body, it seems these encumbrances are mostly just fat or maybe goiters. But when it comes to the face, sometimes it's just the person's features, just the shape of the bones of their head or nose. Listen to Kuhne on the relationship between health and beauty. Quote, "It is characteristic how the form of a healthy person is also that which nearest approaches our aesthetic ideal. The old Greek sculptures have furnished us with truly beautiful forms, and it is these our modern artists take as their model, and not the well-fed, obese men and women who today usually pass as being of normal form. In the normal figure, the head is of moderate size, the neck is round and neither too short nor yet too long. No prominences are to be noticed on it, and in circumference it is about equal to the calf of the leg. The chest is arched, the abdomen is not prominent, nor is the trunk prolonged downwardly. The legs are strongly built and bowed neither inward nor outward. The following characteristics of a normally healthy person have also been remarked. The forehead must be free from wrinkles, smooth, and display no adipose cushion. The eyes must be clear and free from veins. The nose is in the center of the face, is straight in form, and neither too full nor yet too thin. The mouth is always closed, both during the day and when asleep. The lips are a beautifully formed covering and must not be too thick. The face itself is oval, not angular, and there is a clear line of demarcation exactly below the ear. It is this sharp division that gives symmetry and grace to the human visage. Most people remark instinctively the beauty of such a face, but are unable to clearly explain wherein the handsomeness consists. The chin must be rounded, by no means angular. The back of the head should be divided by the neck by a clear line." End of quote. Are you feeling some racism coming on? You're right. I'll spare you the details, including his ideas about facial color. The book is available online if you want to read on. There's a link in the notes. But let's just say he uses the same circular logic as we've heard in an earlier point to prove his point. In other words, there's a serious pathologizing of body fat and a pressure on the patient to control through a near starvation diet health issues which are beyond their control. And when it comes to the face, even bony structures are somehow to be controlled through diet. As Michael Howe so beautifully discusses in his book, The Cult of Health and Beauty in Germany, Kuhne's story of transformation was attractive to people in low-paid or unfulfilling jobs. Not only did Kuhne improve his health, he improved his economic situation, and the two were shown to go hand in hand by his own example. An aside. After writing this section, I had to go for a long walk. I was furious with Kuhne and with anybody in the present-day field of naturopathy who idolizes him. To me, the uncritical reverence for someone like Kuhne is a perfect example of why we need to take a hard, cold, historical look at wellness practices. But as always, the more interesting question may be why. Why does anyone take Kuhne seriously? And I think it speaks to the power of stories. Kuhne's story has outlived him, and it overrides logic. Maybe it was the way his methods allowed patients to make sense of their own ills that made him so popular. And among many other reasons, that's where Gies's book is important. We're still living with that sort of thinking. It hasn't died out. But Gies offers different ways of making sense to the things that happen to her. She turns her attention and her readers' attention to systems, to social conditions, to attitudes, policies, practices that created her suffering, physical, emotional, and existential. If it makes its way into the hands of nurses and doctors, that's wonderful. But those of us who are part of a wellness related profession can't distance ourselves because we can easily become part of that problem too. Knowing about history is important in the journey of thinking critically, but it's also important to reflect on how we're approaching history. A lot of wellness history consists of idealizing figures from the past, focusing on an individual person's journey from illness to health based on some sort of personal and often self-denying practice. I hope more people look in detail at some of these texts, which are freely available these days on the internet. If you're interested in grappling with some of these ideas in a group, you can join my monthly discussions by signing up using the link in the notes. If you'd rather just access the program as a podcast, you're welcome to do that too. Or you can just get shorter podcasts every few weeks with a free membership. However you take part in the work, I hope you find it as fascinating as I do.